Good morning, and welcome to your weekly cup of Joe. My name is Joe King. I'm the owner of Physical Therapy Advantage in North Aurora. I'm here talking to you today on our last of our post-surgical tips that we've been going over. We did a post-shoulder surgery, like a shoulder replacement. We did low back or lumbar surgery post-surgical tips. We talked about total hip replacements last week. And this week we're going to talk about total knee replacements. Typically, total knee replacements are a little tougher of a recovery for people versus hips, but not everybody's the same. But in general, that's what we see a lot of times in the clinic. And so we just want to make sure that you're following the doctor's protocol and restrictions. And for the most part, most doctors don't have too many restrictions on total knee replacements. They want you to get that moving as much as you possibly can to start with, that you can tolerate. One of the big things that we want to focus in on early on, as far as movement-wise goes, is getting the knee straight, getting that full extension. We do work on flexion as well and the bending, but early on, we want to make sure that you're getting that knee straight, because we don't want to walk with the knee bent and always walking with a little hitch in your giddy up. So we definitely want to make sure that knee is getting straight. Taking your medications as well, big thing for knee, post-surgical knee. Tip is that take your medication so you can stay on top of that pain and not have those big overwhelming pain episodes. The other part of it is walking as well, making sure you're walking frequently and make sure you're walking as appropriately as you can, and you're not sitting for too long of a period of time, just like with total hip replacements. Same goes for stairs. Use the railings, go up with the good leg first, go down with the bad leg. So you go up with your non-surgical leg first, you go down the stairs with your surgical leg first. Another one is that, and clients don't really like to do this too much, is that you really need to do your exercises as prescribed throughout the day. So you may be doing your exercises that are prescribed by your therapist and the doctor afterwards 2 to 3 times a day, which seems like a lot, but you really need to do that to get the muscles firing and get that movement going again. And a big one we want to tell people about is sleeping wise. You do not want to sleep with a pillow underneath your knee after a total knee replacement, because that keeps it in that bent position all night long and it'll really lock up and get stiff there. So don't be putting a pillow underneath your knee when you're sleeping and laying down or taking a nap. You can put a pillow underneath your calf though, and your ankle. So you can put it underneath there, 1 or 2 pillows there, which is totally fine, but do not put a pillow underneath your knee. I think I already mentioned it too, but definitely make sure that you're using ice to help complement that medication for swelling control and pain control. If you have any questions about these tips, they'll be posted below, either a link or there'll be a document there that you can download and see. So please utilize those, pass those on to any family or friends that you may know that are going to be having an upcoming knee replacement. But if any questions that anybody has, 630-892-8003. Just give us a call at 630-892-8003. Like I've mentioned before, we want to be a community resource for the Fox Valley region and just help people get educated and make better choices and have better outcomes after their surgeries. Thank you very much. We'll see you next week for your weekly cup of Joe. Bye.